Today topic is hematology. Hematology is the branch of medicine focused on the study, diagnosis, treatment and prevention of blood-related disorder. It covers blood components like red blood cells, white blood cells, platelets, hemoglobin, bone marrow and coagulation mechanisms. Key conditions treated. Hematologists manage both benign and malignant issues, including anemia, bleeding disorder like hemophilia, clotting problems such as deep vein thrombosis, and blood cancers like leukemia, lymphoma, and multiple myeloma. Specialists involved हैं कि hematologists are physicians who treat patient and interrupt tests, often collaborating with hematopathologist, pathologist specializing in lab diagnosis of blood disease via blood films and bone marrow analysis. Diagnostic role. What is the diagnostic role in hematology? Lab work is central with the hematology lab analyzing blood sample for abnormalities, supporting and rapid diagnosis like leukemia that may require immediate treatment. Blood has three main components like red blood cells. What is the function of red blood cells? Carry oxygens. What is the role of WBC? यानी आपका leukocytes. Fight infections and platelet help in blood clotting to stop bleeding. Hematology also include the diagnosis and treatment of many conditions such as anemia, leukemia, thalassemia, hemophilia, sickle cell anemia, and platelet disorder. Doctor use various laboratory tests like complete blood count (CBC), hemoglobin test like peripheral smear, and bone marrow examination to detect this disease. A doctor who specializes in this field is called a hematologist. A hematologist treats patients with blood disorders, bleeding and clotting problem and blood cancers means leukemia. Common tests जो है performed in a hematology lab. Common hematology lab tests evaluate blood cells, clotting and related function to diagnosis anemia, infection, clotting disorder and blood cancers. These are routine in hospital labs like those following NABS standard in India. रूटीन ब्लड काउंट्स यानी आपका सीबीसी या आपका फुल ब्लड काउंट इज द मोस्ट कॉमन टेस्ट मेजरिंग रेड ब्लड सेल्स, व्हाइट ब्लड सेल्स विद डिफरेंशियल्स, हीमोग्लोबिन, हेमाटोक्रिट, प्लेटलेट्स एंड इंडिसेस यानी आपका रेड सेल इंडिसेस लाइक एमसीवी यानी मीन सेल वॉल्यूम, मीन सेल हीमोग्लोबिन, मीन सेल हीमोग्लोबिन कंसंट्रेशन. Peripheral blood film review cell morphology while reticulocyte count assesses RBC production. Second आपका coagulation test जिसमें many tests are available. तो पहला टेस्ट प्रोथ्रोम्बिन टेस्ट टाइम, एक्टिवेटेड पार्शियल थर्मोप्लास्टिन टाइम and fibrinogen level check, clotting ability, D-dimer detects clot. These help manage bleeding risk in infection control या surgical settings. Specialized assay यानी आपका ESR, erythrocyte sedimentation rate, flag inflammation, glucose 6-phosphate dehydrogenase, screening identify enzyme deficiency, hemoglobin electrophoresis, diagnosis thalassemia, common in India, bone marrow aspiration, examination production, issue for leukemia. D-dimer test is indicated primarily to rule out of venous thromboembolism like deep vein thrombosis यानी DVT या pulmonary embolism in low to moderate risk patient. Based on clinical scores such as well criteria, VTE suspicion order it for symptoms like unilateral leg swelling, pain, DVT, sudden dyspnea, chest pain, cough या tachycardia suggestive of PE. Negative results effectively excludes clot in low probability cases, avoiding unnecessary imaging. Other indications: it is useful for diagnosis disseminated intravascular coagulations amid sepsis trauma या postmortem complications often with PTA, APDT, and fibrinogens. Avoid in high-risk VTE process to imaging non-thrombotic symptoms like isolated bleeding. Thank you so much.